It's 2:10 p.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We are breaking into our regular programming for a live briefing from the South Korean health authorities on the coronavirus outbreak. We will be crossing over to the briefing with simultaneous interpretation in English. South Korea reported fewer than 500 cases today, with most cases concentrated in the capital area. All but 32 were locally transmitted. There have been larger and small cluster infections at private gatherings, schools, and workplaces, so the health authorities remain on high alert. They are keeping a close eye on the situation since the Lunar New Year holidays and the possible impact of easing social distancing levels. The briefing is just about to start. Have a look.
네, 2월 20일
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 20th. As of today midnight, we have a total of 416 new local infections and 32 new imported cases. And the total caseload now stands at 86,576. Currently, we have 7,938 people remaining in quarantine, and there are 156 patients with critical or severe conditions, which is up by 3 from the day before. We had 3 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And now here is an update of our major domestic infections. Locally here in South Korea, we have 416 new local cases, 315 reported in the capital area, and 101 in the non-capital area, 30 in Chungcheong area, 17 in Honam area, 22 in Gyeongnam area, and 3 in Gangwon-do province area, and also 2 in Jeju Island. And by regions, here are some updates of the specific cluster infections. First of all, starting from the metropolitan area, in Seoul's Yangcheon-gu district, in relation to kindergarten, we also have 17 additional cases being confirmed. And in Yongsan-gu district, a university hospital, we have 12 additional patients being confirmed, and in total, we have 201 cases being confirmed to date. And in Gangbuk-gu district, in relation to a public sauna, we have 3 additional cases, raising the total to 52. And in Incheon City's Seoggu district, in relation to a trade company, we identified the first case on the 16th, and we identified 11 additional patients, raising the total to 12. And in Incheon City, Bupyeong-gu district, in relation to a nursing facility, we also have the first index case on the 4th of February, and 13 more cases have been confirmed, and a total of 14 have been confirmed to date. And in Incheon City, Gwanghagun district, in relation to a restaurant, we identified the first case on the 17th, and we have 9 additional patients, raising the total to 10 so far. And in Gyeonggi-do Province, Seongnam City, in relation to a ball dance room, we also have identified the first index case on the 13th, and we have 28 additional confirmed cases, raising the total to 29 as to date. And in Yongnim City, in relation to a nursing hospital and daycare center, we identified the first case on the 17th, and 13 more cases have been confirmed, raising the total to 14 to date. And in Gyeonggi-do Province, Namyangju City, in relation to a plastic factory, 11 additional cases have been confirmed, and in total we have 141 people being confirmed to date. And in Gyeonggi-do City, Gyeonggi-do area, Bupyeong City, we have 7 additional patients being confirmed in relation to the Victory Altar, and raising the total as well. And in Ansan City, in relation to the manufacturing facility and Islamic mosque, we have 7 additional cases, and raising the total to 34. And in Chungcheong area, here are the following. In Asan City of Chungcheongnam-do Province, in relation to the boiler factory, we have 5 additional cases being confirmed, raising the total to 165. And in Chungbuk Province, Jincheon City, in relation to a meat processing factory, we have 6 additional cases, raising the total to 23. And next, moving on to Honam area. In Jeonnam, Muan City, in relation to a family gathering, we identified the first case on the 17th, and increased of the 7 additional cases, raising the total to 8. And in Gwangju City, Gwangsan-gu district, we have 3 additional cases in the family gathering, and also in Jeonju City, we also have family gatherings with 3 additional cases. And moving on to Gyeongbuk area, in Gyeongbuk Useongun City, in relation to a family gathering, we have a total of 37 being confirmed to date. And in Useongun County, in relation to an hot spring, we have 2 additional patients, and raising the total to 9 to date. And moving on to Gyeongnam area, Busan, in relation to a family gathering as well as an insurance company, we have 4 additional cases, raising the total to 41. And next, some updates on the new variants. After the 17th, we have identified 20 additional cases of the new variants here in South Korea, and all of them are from the UK variants. 10 have been identified from the imported points of entry, and 10 were also local infections at self-quarantine. And also, we had 8 of Korean nationals and 12 of foreign nationals as well. And as for these 10 people, 5 people have been identified at the points of entry, while the other 5 have been reported at the self-quarantine. And we have done the contact analysis, and we do not have received further infections. And we believe that these 10 local cases are all from are all foreigners, and they are not new cluster infections. They are stemming from family gatherings and other cluster infections in Yeoju and Siheung area. And also, we have the personal relief number. We would like to provide you some updates. We are also cooperating with the Personal Information Protection Agency, and in order to also minimize any risks of the leak of personal information, we have adopted the idea of the personal relief number. And this means that when you are at restaurants or cafes, when you have to write your visitor log information, you can write this unique number instead of your mobile number. This consists of 2 Korean characters and 4 numbers, and so this is a total of 6 digits, and this has been implemented based on the participation and cooperation with the diverse circles. And so it is very easy to use if you utilize KakaoTalk or Pass. So download these applications, and these numbers are easily accessible. And if you make a memo of it, or if you memorize this number, you can also utilize this on a regular basis, just like you utilize your names. And also, once you have a certain number, you can use it until the end of the COVID-19 pandemic. So this personal relief information, we believe that this could also help in reducing the misuse and leak of the personal information, as many of the public have been concerned about. And next, we would like to provide you some updates of the COVID-19 vaccination plans, and here are some updates of the list of the people targets of these vaccinations. And starting from the month of February, we also have seen that at nursing hospitals and the mental health care facilities, we have been receiving these applicants for these vaccinations, and we have seen more than 366,000 applications, and we also see about 93.8% of them agreeing to get vaccinated. And as for the AstraZeneca vaccines, we also will be administering this shot to the nursing hospitals and nursing homes, and we will also provide a detailed schedule and timeline, so they will be distributed starting from 25th. And starting from on the day of the delivery at the nursing hospitals, they will be completing the first shot of the vaccination within 5 days. And also within the month of March, we also plan to have all of the people, the first group, get their vaccinations. And also we will be rolling out our vaccines for those COVID-19 people who treat COVID-19 patients as well as the first responders. And we will also receiving the list of the people subject to vaccinations. And also we will be completing the first dose by early March. And Pfizer vaccine, if they are arrived in South Korea, we will be giving out these vaccines at 5 vaccination centers here in South Korea. And as for the hospitals, which is designated for these vaccinations, we will make sure that these personnel will be trained and educated for the vaccination process. And looking at the latest outbreak here in South Korea, we have some words to the public. We are seeing cluster infections resurging and multiple cluster infections stemming from workplaces. And we are cooperating together with the Labor Ministry, and we will make sure to curb continued spread of the virus. And in order to prevent a further spread of the outbreak here at the work centers, we believe that this is crucial as this can protect the employees while also enable the economic activities as well. And we need to also fully recover from the COVID-19, and we make sure that we also give some words of encouragement to those who are being treated with COVID-19. And we believe that the foreign workers living in South Korea shall also not be in the blind spots and make sure they have no disadvantages as just like other members of the public. In order to ensure all of the people's safety and health, if you have any symptoms like coughing or fever, please visit a screening clinic and get tested as soon as possible. Moreover, please wear your face mask and also wash your hands on a regular basis and comply stringently with these quarantine measures. And as for the easing of the social distancing measures, this is the first weekend after the ease of these regulations. We believe that many people will be visiting the places of worship. And please note that when you are at the places of worship, you need to comply with a safe distance. And after your regular services, please do not refrain from having group meals or small group gatherings. Currently, we are seeing a major outbreak here in South Korea. And it is not yet a moment for us to be complacent. And please refrain from having private gatherings and stay home. And also switch all of your meetings and gatherings to non-face-to-face means. And after the Lunar New Year holiday, compared to last year's Chuseok, we have seen more infections stemming from friends and family gatherings. And if you have visited your hometown, or if you have visited your family members and relatives, and if you have went to crowded, confined, and close contact environment, you need to also wear your face mask going forward and also comply with the quarantine measures going forward as well. And until next week, that is, please refrain from having group gatherings and private gatherings. If you have any suspected symptoms, please get tested as soon as possible. The quarantine authorities will also make sure that we carry out full-fledged efforts to fight the COVID-19. Thank you very much.
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.